Start over?
Yes, there we go.
Ba-da-da-ba-ba-da-da-da-da. Ba-da-da-da-da-da-da. Ha! Welcome to Ring of Fire, where I'm Emmy the Birth Wizard.
And I'm Alex. Bye!
And this is the podcast where we remind you to breathe and get through tough topics. And this week is about VBAC because
I'm so excited.
I'm the co-host, so we have to talk about it at least 3 more times.
Well, that's what's funny. We have to talk about fat birth.
You're right.
I'm the co-host.
Yeah, exactly. So we did make sure to advertise this on different doula boards that we were going to be having this discussion in our Instagram, that kind of thing. So if you guys are live and watching with us right now, feel free to throw it in there. I promise I'll answer your questions. So think, because I'm happy to do that free labor. Only during this time.
Only
right
during
now.
this time.
Other than that, you guys have to pay for a class.
Which I did pay for a class.
See?
Yeah.
See? So Alex knows.
I liked it.
Alex knows. But I wanted to start it out with reminding everyone why I have this knowledge and where it comes from and why we're discussing it. So
Perfect.
Number one thing is I'm a VBAC mom. I'm a 2-time VBAC mom that would read as a 2 VBAC. And essentially what that means is my first one was a cesarean. I am a part of the 25.9% of people who are first-time birthers with head-down babies who end up with cesareans. So about a quarter of the population will end up with cesareans on their first babies, even with head down. And we try and make that differentiation because often there are reasons for cesareans, especially if you don't have a provider nearby who can do breech or whatever it may be. But mine was head down. There was no health issues. And essentially that's a long, kind of sad story. But it turns out to have a happy ending, everyone, I promise. Essentially, I went through the hospital class and I went to a provider down the street who I'll gladly name. It was Mom Doc. It was not Mom Doc Midwives. It was Mom Doc. And I went to Chandler Regional. Also, will gladly name them. And I got treated, as you guys remember from the fat birth episode, like a fat birther. And not treated well. And ultimately I ended up with an induction at 41 weeks because I was told that's what you do and we're recommending it. And I was like, okay, if you guys are recommending it and you think that's best for me. And I had always in the back of my head said I was going to be pregnant at least 42 weeks. So I was not the one running into the hospital trying to get induced, but it was what was recommended. It ended up being a 4-day induction, resulting in swelling, an infection that was running a fever 103 degrees, and a provider who came in and said, either you agree to the cesarean now or we do one to you in 2 hours. And as a final plea to keep my own sense of power in the situation, I opted for a cesarean.
Yeah.
Because I had the infection, I ended up burning through my anesthetics and I felt my cesarean. After my son was born, I met him almost 3 hours after because that's how long it took for the anesthetics to truly kick back in because they had to put me under to be able to complete the surgery. And then he went to the NICU due to potential of interacting with that infection.
Yeah.
And then they kept him in the NICU for 3 days because he was having issues, and those issues were that he was very spitty. The reason he was spitty is because they were giving him formula without our consent.
Oof.
Even though I was pumping every hour to get out colostrum, I had milk fully in within a day. Like my body was ready to do the baby thing. Yeah. And once we changed out formula for the colostrum and the breast milk, all the issues went away. And I went home severely traumatized. I mean, I think you can just still tell, even with all the work that I've done, there's still some trauma there, and it's not a fun story to tell. Like I said, it does have a happy ending. I went home, I researched a ton, I figured out that our system essentially is being messed with by old white men, and it was actually like the Wizard of Oz behind the curtain the whole time, controlling it all. Yeah. And that's when we decided to get pregnant again, go a completely different route. I ended up with a VBAC, and then with my third, I had a VBAC as well. And I think it should be noted that the reason I have this information is because I was a desperate mom.
Yeah.
And I just want to iterate that of when we have these discussions, that the people that you may interact with are desperate for information and may no longer feel safety in any spaces. Yeah. So just trying to put that trigger warning on there, like, this is my story, and I jokingly call it the typical ICANN lady story. ICANN is an awesome organization. It's a support group, International Caesarean Awareness Network, who teaches about how to have a cesarean safely if it is necessary, and how to have it empowered, and if not, how to change your outcomes the next time around. So, yeah. Sorry, I'll take a sip of water because that was a lot of information.
That story is just
and again, it has a happy ending. The reason I'm here doing this work and I have this advocacy and like this is my passion is because of that story. And it was after going therapy the first time for it and finding out I had PTSD. It was the therapist who looked at me and she said, you know, you can make 2 things out of shit. You can either make it fertilizer or explosives. And I was like, I'm stealing that.
I love that a therapist told you that.
Yeah. She's pretty fucking rad. So I truly chose to make it fertilizer. And we're watching flowers grow because I refuse to make it into explosive.
If you're okay with answering, how do you feel like you got over that or moved forward with that, you know? Was it therapy? Was it...
I think it was a combination of a couple of things. One was therapy. One thing that I think a lot of doulas understand because it is a common post, right? Pitocin's evil and all of this. There is a true study side effect that the more Pitocin exposed to the body through an induction can cause a higher likelihood of postpartum depression, anxiety, or OCD. Mm-hmm. That was me. Yeah. Not only do I have a predisposition to those kind of conditions, but the 4 days of Pitocin did that. Yeah. And I know that it did that. Also, when you step into parenthood, questioning your decisions and what kind of authority you have, you're more likely to end up depressed, right? Yeah. That questioning can cause that anxiety. Yeah. So medication, hell yeah. Get on the meds, man. Get on the meds. Because all it's going to do is lift the clouds so that way you can think clearly. Yeah. It's not going to change your brain that much. It's just going to allow it to function. And just as a reminder, if you don't do those things, you'll shut down brain activity. And it can be more detrimental. Second thing was therapy. I did a lot of it. I'm still in it. On and off.
Everybody should be, honestly.
And if you guys follow us.
And doulas really stop. And doulas really should be, right? Not only are you experiencing secondhand trauma, you could also be re-triggering trauma from your own births and your own experiences. Yes. And it's good to be aware of that and caring for yourself.
Yeah, exactly. So therapy was a big part of it. Another big part of it was having different experiences and truly understanding that I had some power to have different experiences. Yeah. And it's the thing that I now repeat to my own clients of there's no way to repeat your original experience. You're a different person, more than likely at a different practice, birthing in a different space. You've learned different.
With a different baby.
With a different baby.
Pregnancy.
With a different body, really. A whole different body. There's no way to fully repeat your birth. Yeah. So if you step out of that fear of it's going to be the exact same, you'll realize how different it is.
Yeah, and how different it can be.
And how birth doesn't have to suck. Yeah. Because I really did walk away from my first one being if that's what it's like, well, fuck this shit.
I'm not doing that again.
Never mind. And I went from wanting 4 kids down to 1, and then I went back up to 4, and I settled on 3. So, the other big component was I had, very fortunately, because not everyone does, is a really awesome partner who saw the things that we went through and was like, how do we fix this? Yeah. So when I told him, we should go to a birth center, he's like,
cool,
let's do it. Yeah. When I told him, these are the things we're going to have to do, let's do it. He was the one who would finish off birth books, and he really wanted to be fully informed and, be my advocate. We fell into the same trap many people do of I don't need a doula. Yeah. And then a 47-hour birth for our second one, we were we're getting a doula next time. Yeah. Just so he could have someone to I'm gonna go take a nap. Turn, tag team. Yeah. But those are the things that helped me with my own birth trauma. Everyone's a little bit different, and came across this stat off of a birth trauma training that I went through that 40% of people on their first type of treatment, it will fail for combating their trauma.
Okay.
What that means is essentially you should keep trying different methods.
So if like talk therapy doesn't work, you should try
EDMR, or you should try art, or you should try maybe like screaming it out, like whatever is the thing, like there's some way to unlock it. Don't give up after the first encountering of it.
So I think that leads to a good question. How would you, because if you are dealing with VBAC clients, how do you talk to people with that kind of trauma?
So,
you know?
I really want to caution doulas in particular, because we have big hearts and we have like these souls that just want to love on people. To remind you that you're not a trained professional, and if you're finding that someone is resistant to a conversation, that's not for you to approach.
Okay. So if someone's like, I don't want to talk about this, I don't want to.
Yeah.
Okay.
It's not for you to approach. And if you find that it might be an issue, let's say you're with a VBAC client. Hey, Deja. If you're with a VBAC client and you're like, oh boy, we definitely need to talk about that one. Like it has to be brought up. At that point, it's up to you to bring up like, hey, we can't tackle this together.
Yeah. But
I have resources for you and lay out the therapists that are in the area, or lay out the support groups, because they will have trained professionals in those vicinities who can unpack that safely. Because the issue, and I really like this imagery, when you unpack trauma like that, make sure that you can fold it up nicely and put it back in the suitcase.
Instead of just letting it be everywhere.
Right. You can't do the stuff in and like hope that it shuts back up, because the moment you open it, we have to make sure that we're kind. Because it could cause more issues, especially going into it, if it's not unpacked safely. So that's a big one. Also knowing what you're walking into, have those conversations in the consultation. Ask, especially a VBAC client, because they should be open to talking about this. Are you experiencing any trauma? Or did you? Like, are there any things that you carry with you to this day from that birth? What kind of things have you done to prepare for this next birth before meeting me? And if they're like, oh, I went to therapy and I did this and I did that, you're probably good.
Yeah.
If they're like,
nothing.
I called you.
That's it. I just called you.
Baby, I love you, but this ain't gonna work. This ain't gonna work. And that's not being unfair to them. That's being fair to you, because again, that's not your training, and you shouldn't be responsible for someone's trauma and how to lead them through that.
And ultimately, you're not trained to what that trauma will do to you. Correct. Right? Hearing that and
and I have to be
working with someone through
extremely careful, because I know of my own trauma. My very first birth triggered my own. Yeah. And then every subsequent birth, I'm very aware of like how it could be triggering me and how that trauma plays out with people. I had one client who I adore, but she had a very close story to mine. Yeah. To the point where I looked at my doula partner at one point. I'm like, I don't think I can attend her birth. Yeah. Because it was too close, and I was starting to step into a place of, I have to rescue her. I have to do different by her. Like, I have to help her because it'll help me. Like, and Emmy, that was 5 years ago. That's not you, right? So, being aware of that as well. Like, I don't go to Chandler Regional. I will never. I don't care what client you are. I'm never going to Chandler Regional, because it's not safe for me to be your doula and there. So that's kind of my tips for that one. Yeah. And I think first and foremost, be aware of like yourself. Yeah. Because that whole like thing of you can't pour from an empty cup, you can't pour from a chipped cup either. Like make sure yours is intact and whole and
you're ready to handle that. And I think that's a good tip for any birth, not just for VBACs, and for this work in general. Yeah. Of how much you probably will experience and feel and see other people's trauma. Yeah. And you do have to be caring for yourself in that.
For sure. And I think that can go missed by a lot of people, because often people end up in doula work, and I'm not saying all, but often, either because they had a fantastic birth and they want to repeat it for everyone, or they had the shittiest birth and they want no one to have it. That's often where they are. Of course, we have childless doulas, and we got doulas of all shapes and sizes for different reasons, but those are the two.
Which we interviewed a doula who's been doing this for like 11 years yesterday, and she said the same thing.
Yeah, and I've been saying it since being here, so that was very affirming. Yes. Like, yeah, all right, I do have it right. So I think it's being aware of that as well, because you had a home birth doesn't mean it wasn't traumatic, right?
Yeah.
So that's something I think gets brought up more in VBAC spaces, though.
Something people are more aware of.
Yeah, because more than likely if you're choosing VBAC, it's because you're like, not that again.
Yeah.
Which is why I truly love VBACers. They're rebels by spirit. They're like, I could do the one that I could schedule, but like, fuck the system. So I want spontaneous and weirdness instead.
So then that does lead me to another question of like, what do you feel like propels people from scheduling the repeat cesarean to VBAC? Like, as the client, like, what is getting them from that? My provider says to schedule one, I'm good, then all of the work that may come with a VBAC.
So what I found over time, at least working with them, and then from my own story as well, is there's something to prove.
Okay.
For myself, we spoke about this on the Fat Birth episode, which if you guys haven't watched, would inform you a bit on this episode, so go watch that.
It was a good episode.
It was a great episode. But on my paperwork was written high cesarean due to high BMI, recommended further cesareans.
Which is funny because you had an infection, you were at the end of a 4-day induction, like all these other things that could have been reason for a recommended cesarean. The fact that at the end that you said, I would like this, instead of waiting for the doctor, the provider to say, I'm doing this to you. The fact that you said that are all reasons for the cesarean.
Yeah.
That had nothing to do with your size.
Exactly.
It's not funny, but I'm laughing.
It's
but
so funny,
there's so many other actual medical reasons that a cesarean was recommended. None of those are there.
Yeah.
High BMI. That's why.
Right, exactly. So I'm a former rugby player. I lifted weights. Intensity is not a problem for me. And I found it insulting that they're like, you're fat. That's the problem. And I was like, I will push your car around this parking lot.
Especially at the end of a 4-day induction.
Right. Like,
that's so many days.
Yeah.
So many hours.
Yeah. And none of them are well slept or any of that.
Yeah.
So I do find there's a large category of like, I have something to prove, and like that, like, fuck you energy. Like, I'm going to do this. Yeah. Whether you say I should or not. The other one that happens is that you have a baby at home already and you don't want to be at the hospital for 3 to 4 days. Mm-hmm. And so the decision is not, when will I have my baby? It is, when will I get home?
Yeah. Who's going to watch my baby? Who's going to watch, who's going to be with everybody else and care for everybody else?
For 4 weeks, I'm going to be down and out.
Yeah.
So that's another big factor that a lot of times people will consider that VBAC, a lot of times due to privilege reasons, right? Yeah. Like they don't have the childcare or they don't have the support or whatever it may be. In my case, I did, but that still was a factor in my brain. My son was my best friend at the time. Yeah. I didn't want to leave him for more than a day. Yeah. If I didn't have to. So that's why I went that route. The last reason you'll see is essentially for health concerns. Okay. So it is documented with evidence that repeat cesareans carry more risk than VBAC does. Yeah. So when an individual, especially if they're already at a place of like, surgery is not great for me, I didn't heal well, or
or the fact that it is a surgery,
a surgery, especially after a 9 to 10 month pregnancy, and they're like, I just want to be able to hold my baby and go home. That's a big factor too. So I find it's one of those three. Obviously people come from many different walks as to why they got there and what it means to them. Some people literally is, I want a baby to come out of my vagina. That's what I want. I want that moment. And I've been there for that. I do caution people that don't relate VBAC to vaginal birth. And a lot of times people do relate those two because they're like, oh, vaginal birth is in the name. It's like, it has more to do with choices being presented to you.
Yeah.
So
like being able to make those choices instead of things happening to you, taking that power back, even if it ends at another cesarean.
Right.
Yeah.
And it's really important for me, at least, to make it clear there's still power in cesarean, right?
Yeah.
Like, even in my story, there's a power in the fact that I chose it instead of letting it happen. So, and people who choose cesarean, there's a ton of power in that. And I find that sometimes people, again, will, like try and muddy that, like, space there. I'm like, no, those are numerate.
Do you feel that there's... So, obviously, being in the birth work community, you see a lot of, like...
Anti-cesarean
is bad, right?
Anti-C-section, anti-belly birth. Oh, don't say belly birth, guys. Please stop.
You hate it.
It is so condescending. Oh, did you have a belly birth? Like, I'm not a child. Also, it was a major surgery. Thank you.
Yeah, it is a major surgery. So we know that's how the birth work community feels about that. Do you find that people outside of that community think that way? Or is, like, the everyday birther like, well, yeah, that happens?
Ooh, okay, so let me answer it this way. It's really dependent on the family's birth culture or the exposure they had. There are certain families I've interacted with where they're like, yeah, whatever, cesarean,
let's do it. We can schedule it.
Right. And there's already that culture inside of the family. And when that person decides for VBAC, there's a lot of blowback of like, why? Why wouldn't you just choose to, like, schedule, and then you get to meet your baby, and then we can, like, rally around you after the 3 days.
We can all plan for it, and
Exactly. So there is that crowd where that's the culture inside of their family. There's the other folks that I find their culture inside their family is there's never been a cesarean, or it's not been discussed that there's been a cesarean before.
Yeah.
And so they're extremely fearful when the cesarean happens, or they feel like the weirdo for being the one in the family that had the cesarean, or most often word I hear, I failed.
Yeah, that language is everywhere.
And it's really rough. It's really, really rough because to a certain degree, and I'm calling out my birth community, you're perpetuating that.
Yeah.
You're perpetuating that.
You're perpetuating what the OB is writing in the op report, right? Failure to progress, failure to whatever, right?
If you had just done more spinning babies, that wouldn't have happened to you. If you had gone to a chiropractor, that wouldn't have happened to you. So, let's be conscious of, like, how we write those.
Yeah.
Because it's not my fault that I ended up with a cesarean. Yeah. It is, for me, agreeing to an induction of 4 days. But even then, I went at 41 weeks. That's a favorable time to do that. Right? Yeah. So, just
this language around, like, you could have changed an outcome, or even that a doula could change an outcome for someone is kind of wild to me. Like, if you didn't say yes to the induction, if you didn't say yes to the membrane sweep, if you didn't say yes to this, right? First of all, that does nothing for you, right?
Right.
It does nothing for you after the fact to think about, like, all the things that went wrong, right?
Yeah.
It does, like, traumatize you more to sit there and think about, like, oh, these are the things that I messed up on, right?
So the two things it was like the day after I got home, I came across VBAC Facts, which is Jen Camel, who's, like, incredible. Please go follow her. She's been an advocate in this community for 14 plus years, been really, really doing the work. I came across one of her blogs that talked about the cascade of interventions, and it clicked of, like, holy shit, it's not just me.
Yes.
Oh my God, like, that's what led down this path of Birth Wizard, truly, of me being like, more people need to know that this is a thing.
Yeah.
The second big impact in my life, it sounds dumb, was I was watching Moana in theaters.
Yeah.
And Moana goes up to the fire lava goddess, right? And she's like, this isn't you, and it does not define you.
Yeah.
And I broke down crying. Like, it was an ugly cry, guys. Like, there were snot bubbles. Like, people were looking over their seats like, she okay? And it was because it hit me so deeply, because after this, this goddess is affirmed of, this doesn't define you, this isn't you. Oh yeah, I am. I'm okay. I always think of these moments and I can come right back to those feelings. But it was one of those me letting go that it did not define me. Yeah. The choices I made did not define me. The birth I had no longer defined me. Yeah. It just was, right? Yeah. And it's so easy, kind of what my therapist said, of creating that shit into explosives. Yeah. And I was teetering on that edge of explosive. Yeah. So this was all to say, just be careful when we're talking about cesareans. Yeah. And to be quite frank, a valid cesarean is none of your goddamn business. If the person chose it, I'm super stoked for them. I think that
people, from what I see, I think people misinterpret, right? They think that the cesarean is the problem, is the actual issue, right? When it's not. The cesarean alone, and a cesarean that you chose, or that was for the right reasons, or that you had the power in, right, is very different than doctors mishandling things. Correct. You not being given informed consent. I think there's these other factors that may lead to cesareans, right? And other ways cesareans can be traumatic. And I think that we've equated it, in the birth community at least, to be oh, that means all cesareans are bad. Every time my client has a cesarean, it's a oh man kind of moment. Yeah. When it doesn't have to be. Correct.
Correct. And I'm a big advocate for, that's your baby's birthday. We should be celebrating it's a birthday. Yeah. Even if it was a planned VBAC and we ended a CBAC. And CBAC people are made of all the good stuff. Yeah. I think they're incredible, because these are individuals who prepared their bodies and their souls and their minds for a VBAC and ended up with essentially a repeat cesarean. Yeah. But they go into it on the other side, and you'll see those people be I fucking did that still. Yeah. Which is still them taking back that power over that situation.
They're the same outcome, but very different experiences.
Correct. Yeah. Yeah. So, because I made sure to keep notes so I would keep focused.
We haven't looked at them once. We are 30 minutes in.
Oh, yeah. No, I knew what I was doing. So I've gone over why it's important, how we need to be aware that the cesareans aren't the issue. It's how birthers are treated around them. Making sure, if you're a birth worker, know what the basics of a gentle cesarean are, and what choices are available at your different providers and hospitals. Even if you're attending a home birth, that person should be made aware of it, because if they're going to end up with a transfer that it ends in a cesarean, give them at least the dignity to know what their choices are, just like you would in anything
and know
else.
Where they're going in. Yeah.
Correct.
I wonder, and I have met a few birth workers and doulas who do not discuss cesareans and cesarean options.
I'm going to fight you.
They don't discuss them at prenatals or prior kind of thing.
So here's something that I really want to challenge those people on, and I teach it in my class. By not having that discussion, you're opening the person up for more trauma. Yeah. And who is that non-discussion for? Is it for the birther, or is it because it made you uncomfortable? Yeah. And if it's because of you, assess.
You have some work to do.
Why? Why does it make you uncomfortable that a baby came into this world still? Yeah. Safely. Yeah. Where the birther got choices. Why does that make you uncomfortable?
Because those choices could be made ahead of time. Those conversations could be made ahead of time, right? Correct. And time to even mentally know, these are the steps of a cesarean.
Right. And I'm not saying that it has to be a whole nother prenatal. We don't need to go into that amount of education, but at least having the bad guy conversation. Yeah. Because you're not there to be their friend.
Yeah. It's on my birth plan. Right. It's a part of it. If a cesarean happens, here are your options. Here's some things to think about. Here's some things to take to your provider to ask. Yeah. If they offer things,
Yeah, for sure. It's really important, and like I said, I'll fight a person over a fight. The only time I'll fight a person.
One of my one of our mutual friends who's a body piercer always says, like, it's about just no surprises, right? Because the surprise is the scary part. The surprise is the trauma part. And I was like, that's it,
ding,
right?
Ding, 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 ding.
So no surprises, right? We know at least the basics of what will happen if a cesarean needs to happen, especially if it's an emergency cesarean. And I don't have time to tell you, this is what they're going to do.
Right.
Right? As it's happening.
Yeah,
you know?
yeah, exactly. Okay, so the last point I have, and then we're going to go into questions, because I had a handful, and I want to give those time, is why I think VBACs are the best birth. And again, it's just personal opinion. Not only am I one, but here's the reason. VBAC teaches you as a doula the basics of birth and physiological birth. It also teaches you the basics of cesarean, teaches you the basics of birth trauma. It teaches you like intersectionality and how that can come to play with someone's birth and all the choices that you may have in between. And then also gives you a peek into the advocacy work that may still need to be done.
So what do you mean by that?
So I'll give an example. A lot of people are like either on the spectrum of once a cesarean, always a cesarean. Well, that means some advocacy work needs to be done in your area if that's the choice being made or even like presented, because that's not the truth. And we've even have support by ACOG saying it's a safe and reasonable choice, and your providers being unethical if they're not offering it.
Fair.
So some education needs to be done, some advocacy needs to be done, some sort of systems need to be done. On the other side, it gives you a peek into the advocacy that may need to be done with racial stuff going on in your area, because we know in studies that more often white individuals are offered VBAC over black individuals.
I wonder if that's because VBAC calculators factor race into it. I wonder if that's why.
They used to, up until 2021, but fun fact, if you guys took the class like Alex did, there's 4 separate VBAC calculators out there. Yeah. Only one is up to date and the others are not to be used. However, not every provider knows that. Yeah. So it's really important that you as the doula understands which one, and also that VBAC calculators are flawed beyond flawed.
It sounds like they're just for fun, right?
I had one of my own providers compare them to tea leaves.
Right? Like to me, it sounds like we're just gonna guess. We'll see what it says.
Essentially,
it sounds like a fun time.
Unfortunately, though, a lot of times providers will use it as a way to send you away or talk you into the cesarean. Yeah. And so, being aware of that, not only as a birth worker, but as a person. Yeah.
And I don't mean fun as in like fun for the birther.
Oh, no.
I mean like this is like a fun activity that means
really
mostly nothing.
It's as accurate as like tea leaves, as the one provider told me, or like a Cosmo like quiz of like, what would he want for Christmas? Is it your ass or your ass? Like that's.
Am I gonna have to edit that out? I think so.
I think so. I don't think anyone's on with us either.
There's 2 people. Hopefully it's not my grandma, because she was here for a moment.
Hey, Grandma. But God damn it, now I gotta get back on topic. No, you're cool.
I just could not stop myself from reacting to that. Oh.
I'm so sorry.
You don't have to apologize. It's the best. It's the best part.
Someone's over there laughing. Check.
That was awesome. And I love you guys. And then the top one says, y'all kill me.
But know that they're flawed. Throw them out the window if you can. And true VBAC-friendly providers honestly won't pull them out. Okay. True VBAC-friendly providers will look at you and be like, did you have a prior cesarean? Yep. You're cool, bro. Let's try this, right? Yeah. Because the only big risk factors are truly the type of scar you have, If you've had a prior scarring on your uterus, because a lot of people don't realize that if you have any scar in your uterus, you're considered a VBAC. So let's say you had an appendectomy, which is essentially to remove fibrates from your uterus. You're now a VBAC, even if you've never had a baby before.
Interesting.
So when you go in and you're like, hey, I'm pregnant, and they see that on your surgery record, make sure they check if your fundus was cut during the surgery or not, because that will make you a candidate or not. And have those discussions if that's going to be like...
That's a very interesting fact. Fun
fact. So something to be aware of, that it's not just cesareans that cause scars in uteruses, but like appendectomies, or even to remove like endometriosis, like cells,
like cysts or stuff.
Cysts can also cause that, right? So being aware that a scar in the uterus still puts you in that those realm,
and the same risk factors that a VBAC would have.
Correct.
Okay, that's interesting.
And so that's why it's also a discussion, right? Those are people who may not have even realized what kind of obstacles they would run into once they decide they want to have kids. Because they're in pain and they want to get rid of it.
That should make the top highlights for this podcast. Don't worry, I'll cut it out so it doesn't go on YouTube, but it will be on our Instagram, I'm sure.
She'll bleep me, I bet. It would be funnier if you bleeped me.
Need to? Right? Like, I think cussing's okay. I don't know about...
Bodily parts about sex? Yeah,
probably
that's
not.
off limits.
I think that's off limits on a lot of places.
The other part that I really enjoy about VBAC is that thing that I was talking about of you get to experience like a bunch of intersections and like understanding like how that plays with birth and different people. So whenever I interact with a first-time birther, I know physiological birth like the back of my hand now and like how to teach it and for people to be fully prepared for it. If I have a person who's like, I don't like anyone in my valley, like I've met like 3 providers and be like, that provider sucks, this provider sucks, because I've interacted with so many providers with VBAC, right? So this is like going back to a different episode. When you niche, you're powerful.
You're gaining power, because even though you are niching for that and you interact with a first-time birther, doesn't mean you don't have all of these things.
Correct.
Because if a provider's shitty to a VBACer, they're probably going to be shitty to everybody. But you found probably this intersection where like they are going to show their ass, like right, like they are going to show like where they're not the best providers.
Correct.
You know?
Exactly.
I'm only a good provider if you are a low risk first time mom.
Right.
Birther, sorry. But
no. Yeah, exactly. So, and I think that's that thing of why I'll get first time birthers like as my clients, or I'll get the like person who's had 4 kids at home, because they understand like if we need to go to the hospital, this chick knows how to advocate. Like this chick knows like how to operate in these spaces, because I do got it. Like those are spaces I'm in a lot, and I know who to talk to and like get balls rolling faster. So that's what I can say about VBAC and like why I love it so much and why I think it's important for everyone to at least have some amount of training on it.
Yeah.
I will, and it's a speech I give inside of my classes, be aware that if you are someone who has a VBAC client, that there are these like super high highs, and they are pure magic. They're pure magic of like watching someone against all odds, like in that way, have their baby in their way, and like you can feel the magic in the room, that like glow. Or there's super low lows. And it's someone devastated, it's someone going in not ready, and I cry in my car after, right? Never in front of them, because I'm like, you did great. I'm proud of you. You're so good. Look how powerful you are. And then I go in my car and I cry, because my job is to hype them up, not for them to feel that sadness off of me. It has nothing to do with them, but realize that might be something you interact with, and like be careful with your own brain and like your own
reaction to their experience. Because
it's okay to mourn a plan. It's okay to mourn the like but they tried so hard and they did everything right. And I've had so many who did everything right. I mean, like, I had one who basically became a spinning babies instructor. Like, she was teaching me stuff, and I was like, this chick's gonna get it. Yeah. And it didn't happen. Yeah. And I've had the other ones that just show up and be like, can you be my doula? And then I never hear from them until the birth. And then they, like, push out a baby. I'm like, why? Why you? But not, like... Yeah. So just be aware.
Just to show, like, you literally cannot change an outcome.
No, you can't. You can't. I've tried. Yeah. I've tried real hard.
Yeah.
And I think, going to your point, that's another thing that VBAC teaches. Like, if you get focused on the outcome rather than the experience, you'll burn out really fast.
Yeah.
So yeah, outlook over experience, outlook over outcome all the time. That's kind of become my basis of my doula business. Is like, I really want to make sure when people walk away, they have the best outlook on their birth.
Yeah, that they could have.
Yeah.
All right, so some people asked some questions.
Tell me your questions.
That we're going to answer.
Let's do it. So, from Love What You Doula.
Okay.
This was a doula who ended up asking, what things should a VBAC do physically to prepare, or what things should she avoid? What things or resources as a doula should I offer to help them in labor?
Oh, that's a lot of questions.
That's a lot of questions. So, number one thing, what things can you do to help prepare? What things can a VBACer do to prepare for that kind of birth?
Yeah.
Number one is therapy. Number one is therapy. Because
which I will die on the hill that everybody should be in therapy.
Right. Number one is therapy. And if that's out of their reach, having them go to ICANN meetings to at least process whatever happened, because it's highly likely that they didn't process it. I'm usually shocked when they come to me and like, I did that.
Yeah.
I'm like, wow, look at you. Usually they haven't, though.
Yeah.
The second thing is making sure that they're with a provider that is safe and friendly. So just to like credit a really amazing midwife who came up with that term as midlife Malik, and I'm not even going to get into that drama, but number two is making sure that they're with a really great provider and in a setting or a space that is supportive, because you could have a great provider at a shitty hospital.
Fair. Okay.
Or a shitty provider at a great hospital.
Yeah.
But we need the combo of both.
Yeah.
Preferably, and if we got to do
not like,
one.
And VBAC friendly means like not just like, yeah, I guess.
Right.
Like,
yeah.
VBAC tolerant. Right. Is that what I've heard? VBAC tolerant versus VBAC friendly. Okay.
Correct. I use the term safe or unsafe because that's really what we're talking about.
Yeah.
But tolerant is where they're like, yeah, I guess you could. It's dependent if like you fit this criteria and I don't pull the plug.
Yeah. Where they could like take it away in a second, or they're gonna find a reason to say, throwing it out the window.
And to be real with you guys, this is the other reason I love VBAC, but it also breaks your heart. There's a lot of areas of our own country and the world where it's not accessible at all. So that's when I make friends in the free birth community, because I'm like, I would love to help you, but there's no one in our area who can help you. But I do know some other people on the DL like, that can help you out.
Yeah.
Oops, a baby came out while you were at home. I really like the oops. Oh no, I
accidentally had my baby at home.
Oops. Oops, no.
Hopefully everything's okay.
So those are the two biggest things you can do to prepare. Some extra fluffiness.
Yeah.
Chiropractic care, acupuncture, yoga. I really love telling people yoga, and the reason why is it helps you sustain long holding poses, which not only helps strengthen you, but it helps your mind, right? You're able to hold that, and if you're able to get up to a minute or 2 minutes on certain poses, when you're in the midst of a contraction, you're gonna breeze right through that, because you're like, I've already interacted with my mind and my brain. And
I don't think people realize how good yoga is for your mind.
No, I don't.
Even like a yin yoga, which is like even to the more where that's going to be like you're holding poses for 3 to 5 to 7 minutes.
Yeah.
Like you can
you can do it.
You can do it. Yeah. Right. But mentally, it's going to help you become stronger in that way.
Yeah. And then spinning babies. I think that's a really great way to do it. I would highly encourage a childbirth class because often they come to you with no childbirth education or very little, or like me, a hospital
even if
class.
they already had a baby.
Right. Because often during my consultations, they'll be like, and then this thing happened and I don't get what happened. And it's like, you still haven't even like deconstructed your birth to figure out what went down. Okay, let's talk about what D cells are. Like, or let's talk about
or
like
why this stuff happened,
right,
in a medical sense.
Correct. So they often need that extra education.
Okay.
Just to throw it out there, Birth Wizard offers VBAC classes literally for families. So I'm just gonna plug myself the whole fucking time.
You're doing a VBAC episode. How can you not plug yourself?
Exactly.
You literally created this stuff because people needed this information and couldn't find
it. The next thing that the person asks is, what can I do as a doula?
Yeah.
And what can you do is truly educate yourself on the resources in your valley. Reach out to other doulas.
In your valley,
in the valley or in your area. Also make sure that you're talking to people who have experienced VBAC birth or like join the meetings for ICANN, although you may not be able to join their like private Facebook group because they keep birth workers out on purpose because they don't want people being predatory in there. Because gross, guys. Thanks.
Yeah. But listening to those people and their stories and what they're experiencing.
Correct. And then unpack your own shit.
Yeah. And don't we know somebody who has a VBAC podcast?
I have a VBAC podcast.
Share VBAC story.
Sure do. I don't know who that person's
Sorry to just plug again, but it was right there.
Right. So I do have a VBAC podcast where we listen to stories and we give out information. It's called VBAC'd. It's coming into its coming back from its hiatus very soon. Yeah. And essentially it's with my dear friend Carrie, who owns Ginger Blossom Doula Services over in Michigan. She's 4 years running of like the top doula in her area, like voted.
So cool, yeah.
She's incredible, and she's also the brand new birth wizard for that area. So extremely knowledgeable. We're happy to give out that information for free. Yeah. And then I do have the training if you guys want to be a VBAC wizard, and I'll give you all this information so you feel fully prepared.
And like so much more.
Right.
Yeah.
Some other people that I say, okie dokie, if you're not going to take it with me, I would highly recommend this gal by the name of Taylor Davis. She has a really great VBAC doula education course. Mm-hmm. And then VBAC Facts, I really enjoy their professional side. It's dense. Be aware that you're essentially joining like the evidence-based birth of VBAC. Yeah. So like,
which is dense,
but man, you're gonna come out and be like, I know everything. Yeah. You'll be able to take me on because like so much information I can't consume it all. Yeah. But those are two that if you're not gonna take it through me, take it through Taylor or go join VBAC Facts if you want more information. I would not recommend VBAC link, and we'll get into that later.
We're gonna do a separate section of that. All right, next question.
The next one, about red raspberry leaf tea increase your chances of a uterine rupture? No. There you go. It does not. Red raspberry leaf tea strengthens the uterine walls, is essentially what it does. It strengthens muscles. So it's a good idea to consume it. Yeah. However, if you abuse it, you could cause cramping, but it's never going to cause a rupture. At least not scientifically
there's no evidence
stated.
Based. Yeah.
Right.
There's no evidence stating that. Yeah.
No. Just like dates are also a really fantastic way to strengthen those muscles. It also helps with like vitamin E and like fiber and all sorts of things, which is also highly recommended. Your poor VBACer is going to consume so much tea and so many dates. They're going to hate it. So maybe as a doula.
I was so over dates at the end of my pregnancy.
Maybe as a doula, we should all learn more like date recipes. Yeah. I think that's honestly how we can help our people.
Them. Just like, all right, I gotta eat 4. I wasn't gonna cook or make them into things or add them to smoothies. I was like, all right. It's like when you take a pill and you plug your nose. I was like,
I personally love dates. I think they're fantastic. I'll eat them all day, every day.
Gross.
I really like them on bagels with some cream cheese. Yeah.
I'm sorry. I just keep thinking of what you just said.
Oh my god.
You want to censor my ass and puss. Okay.
Last
I'm
episode
gonna have to
was chaotic. This is gonna
just that one part, but it's okay. If we cut it out, no one will ever know that this happened.
Yeah, so red raspberry leaf tea, you're good to go. I often tell people to almost brew it like a sun tea and keep it in your fridge.
Yeah.
More like an iced tea, because it's really annoying to like put a bag in a cup, warm up water, and then drink the one cup, especially when you get towards the end of pregnancy. Like that 41 weeker is supposed to be consuming about 3 cups of tea a day.
Yeah, so if you make a whole gallon, then it's there. Yeah.
It's so much easier, and then they can like not have to think about it, and that helps. I also work with people with neurodivergency, so if we can take away
help
that like executive dysfunction issue
of making a cup of tea 3 times a day.
Like, and again, VBAC more than likely has a baby already in the home or a child. We don't need to give them another thing.
Another chore,
You're right.
Yeah.
Especially when they're supposed to be taking care of themselves.
It is interesting to me to hear people that like that is something that people are being told by like, oh, uterine rupture. Would you be able to purchase red raspberry leaf tea if it caused something that catastrophic? Right?
I think it's fascinating how many people want to talk about exploding uteruses, but we don't want to talk about how a repeat C-section still puts you at a chance for exploding uteruses. Yeah. Right? Like,
it doesn't solve those problems.
No.
Yeah.
And as a reminder, first-time birthers can end up with uterine ruptures.
Yeah.
I'm going to repeat that because some people like to question me on it. First-time birthers without a scar in their uterus can still end up with uterine ruptures.
Yeah.
It's a 0.007 chance.
Yeah.
There's still a chance.
Yeah.
And it's when they're interacting with cytotec or Cervidil.
Yeah.
And that happens.
And that's something that's so commonly given in hospitals.
Correct.
And in inductions.
Yeah. Just as another reminder, Cervidil and cytotec is a drug used for abortions. It's not FDA approved for inductions. Yeah. So anyway, I won't get into this exploding uterus conversation, but yeah.
Still a conversation. This says, this is officially an R-rated podcast. And it says that red tea capsules are an option too.
Yes, they are.
I didn't know that.
Yeah. For some people who don't enjoy drinking the tea, I do know that some people prefer the capsules because you can measure the amount that you're intaking. Unlike a tea where like you might not know.
It's like a diluted or like a That's
or did you add 2 bags instead of 1 bag to your cup of tea? Like right?
And how much of that transferred to the water and blah blah blah.
Yeah, so I have heard of people preferring the capsules, especially.
You got one more question?
I got one more question, which is I have 2 more questions. Sorry.
Okay, 2 more questions. Sorry.
What kind of questions should a VBAC birther ask their provider to figure out if they're supportive or not?
Do you use a VBAC calculator?
Hey doc, what's my calculation? What you feeling? 20 or 30%. I actually have a really sad story about VBAC calculators, and then I'll answer this question. Okay. So I went back to my original provider.
Oh, this one is sad.
I
hate it.
She's heard this one before because it's a part of my training that I show off why VBAC calculators are bullshit. Yeah. So I went back to my original provider when I found out I was pregnant with my first VBAC, my second child. And when I came in, they're like, all right, we're just going to do a quick calculation. So they pulled out their VBAC calculator and they're like, yeah, you're well within range. And I saw the things that they punched in, and one of them was that I'm white. Fun fact, I'm not white. I know. I'm not white though. I'm Latin. I'm Mexican in particular. Yeah. And so when I corrected them that I'm what will be the pull down menu back before 2021 removed this was Hispanic white.
Yeah.
Right? So they changed it, and my percentage went from 60% to 20.
Which, logically, if we want to talk about this on a logical level, there is no reason why someone who is white would be able to have a successful VBAC, and the same person who is now not white with all the same other factors would suddenly not be able to.
Correct. And the thing that I found really interesting in that moment was like, whoa, you guys just said I could go for a VBAC.
Yeah.
So if I had shown up off the street ready to give birth and did not tell you I was Hispanic, you would have let me try?
Yeah.
Well, that's fucking bullshit. Like,
that's racist.
And
absolutely, like, there's not another word for that.
Right. And this poor nurse practitioner who was not prepared for me was like, I mean, it's not like that. It's like, no, it's like that. It's like
and
that.
Maybe you haven't thought about it that way, but
right.
it is like that.
Right, it's like that. So that's my VBAC calculator story, and that's why when I ended up with the providers I did, they made that comment about tea leaves, because I was like waiting, because I was so nervous when I went into them, and this does relate over. I had a book full of questions because I had already been denied by a couple of providers because my first two were due 16 and a half months apart.
Yeah.
So fun fact about VBAC. Here in the state of Arizona and in many states, depending on the distance between the two births, you are disallowed from certain care providers.
Yeah.
So 18 months and beyond between those two births, you can have anyone be your provider. Any closer, then it has to be a CNM or an OBGYN or a naturopath.
That's weird. That's odd.
Because naturopaths are still doctors, and they get to make their own rules. That's the benefit of being a naturopath.
But I that is so interesting, because again, when I was just a first time birther, I thought that there was this hierarchy. There's not.
No.
Like, this person says you're high risk, this person's like, come on over, and like it's this whole mishmash of things, and I don't think people realize that.
For sure. So some of the questions that I highly encourage people to ask is, one, what's the call schedule like? Are you going to be there the day I give birth? Is it a team? Do I meet that team? And that can work either with a home birth setting, a birth center, or a hospital setting, right? And so, like, being clear, like, who's going to interact with you? Because if it's just the provider in front of you who's going to be VBAC friendly and they're awesome and they're going to be there no matter what, great. Let's do this thing. But if they're in an office with like 6 other providers, I would highly recommend you meet all 6 of those providers before you...
Because they all need to be supportive. You can't chance that the one who isn't the VBAC friendly one is going to show up at your birth.
Correct. Someone asked a question.
Can you expand more on VBAC calculators? Like, probably what they take into account? Like, what numbers you plug in?
Yeah, so the newest one, what it takes into account is why... More is there. Why...
It says, where do we find them? What truly counts? And do you believe anything counts? Like what counts towards whether or not you have a good...
I'm going to tell you, Jack, because I know who's asking the questions, exactly what's going on with the VBAC calculator, and it's not opinion-based.
Yeah.
So, when it comes to VBAC calculator, they're going to make you punch in the reason for your cesarean. So for some people, it's like arrest of labor, or several other factors are put into there, breech, or whatever it may be. They also have you put in there your age. They have you put in like the distance between your pregnancies. And there's like 2 other things in there now. They used to have your BMI. They used to have your race. They used to have like all of these other factors that they've pulled out now. Here's a fun fact about VBAC calculators. If you were above a 60%, then providers would be like, hell yeah, let's do this thing. However, they were supposed to throw out the number if it was under 60% and still say, hell yeah, let's do this.
Which is what I'm saying about it just being for fun. Like, if you get a good score, good.
Right.
If you get a bad score, throw it away and it's still good, right? It seems like there was no point in plugging in these numbers and trying to figure out what your VBAC calculator said.
So here's the reason why it came about. So it was a really in-depth study that brought about the VBAC calculator, and it was supposed to allow providers to know how much liability to put on the individual versus themselves.
Yeah.
That was its original purpose, and it wasn't even supposed to be used on people. It was supposed to be used in a study space only.
I wonder what other things were not supposed to be used on people.
Right?
Maybe BMI?
Right. Right. And that's why I think it's funny that you and I became friends, because it's very, like, I find it very similar of, like, fat birth and VBAC birth, of these things being put on your body or being told to you where it's like, that I mean, it doesn't check out, but cool.
And there's a lot of, like, things that cross, like, the amount that, like, people who are not white, how much, like, BMI impacts their experiences, people of color, black people, like, all of that is, like, such a factor with that. It's so it's more magnified when you're not white. Yeah.
So I hope that answers your question, but that's essentially it. I don't want to give too much away. I do want to encourage you, though, to keep reading on it, because the more you understand about VBAC calculators, you can maybe understand the disparities going on in the birth community, like, in general, and, like, the medical industrial complex, because it's one of those where you're like when the tip of an iceberg. When
There's so much more to talk about.
When you learn about that, suddenly you're like, what else is there? Like, then you find Wizard of Oz. Like, you find Oz and you're like, it's an old white man.
Well, if anybody didn't watch our last episode, it turns out that everything started with Nazis. So
Nazis. Yeah.
It was Nazis all along.
So going back to the questions, right?
Yes.
Yeah. So the questions I would have them ask is, like, who's on call? I would make sure that they're asking, like, what is your percentage of VBAC here?
Yeah.
True, transparent, and, like, VBAC friendly providers, which we know of several in our valley at least, post their stat of how many end up with successful VBACs versus not, right?
Yeah.
And they're transparent with that. Are you cool with me bringing a doula? Or what does, like, support look like? I would also have them answering questions along the lines of, like, if I gain weight, like, what does this conversation look like?
Yeah.
If, like, something happens with baby, what does this conversation look like? Right? Am I still able to attempt a VBAC if there's a heart condition? Yeah. Or if it turns out I'm carrying twins? Or, you know, like, really suss out,
like what is the point where you're like, nope, sorry, schedule the cesarean. Like, it's good to know what those limits are for that provider.
And there's lots of people who have done the blog, like, posts out there of different questions you can ask, and I can tell you there's 1,000 that you can ask. It's really about going with your gut, though, ultimately. And I have a hard time with this question because truly privilege can play into it of like, how many choices does this person really have, and how much of it is going to be like grit of our teeth, like we're just gonna like fight every step of
we're gonna show up pushing, we're gonna accidentally have our baby at home, we're gonna whatever, whatever the extreme you have to go to, or can we afford out of hospital care, that kind of stuff.
Exactly. And then the last question I received, which I think is a really important question, is how do I talk to my client without breaking their trust in their provider about, is this person the best choice?
Which I think is a great conversation to have about even non-VBACers.
Correct.
Is like, how do you as a doula who knows that this provider does not have a good reputation, or you've had negative experiences yourself or whatever, how do you gently say, run away?
So here's what I will say. And this is me from my own practice and for myself. And this goes back to our scope conversation of what are you comfortable with doing? Yeah. Emmy is comfortable telling you as my client, this is bullshit that you're running into. Yeah. This is dangerous bullshit that you're running into. Yeah. Please consider changing.
Yeah.
I don't think you want to fight the whole time. I don't want to fight the whole time.
Yeah.
if you want to, we'll do this, but that means that you have to be 100% dedicated once we're home and doing the labor thing.
Yeah.
That means no quitting. That means like I want to see a baby almost coming out of you.
Yeah.
When we're getting in the car.
Yeah.
And I want to be sweating it that it's going to happen on the freeway.
Yeah.
And if you're prepared for that, cool.
Yeah.
We're prepared for that.
Because then is that so that they spend less time around the provider who
yes.
you know is not supportive?
Yes. Or in the hospital where they're not supportive, or around potential nurses that are not supportive. And honestly, it's the advice we give to every birther. Stay at home as long as possible because the oxytocin is going to be higher, right? This is not unfamiliar advice.
Yeah.
The difference being this is advice that will keep somebody out of an OR.
Yeah. It's a bigger deal. Yeah.
So that's the conversations I have with my people.
Yeah.
Gentler ways to have those conversations. One of them can be during the consultation, ask who their provider is, and you're allowed to not take them on.
If this is someone you're not comfortable working with, yeah.
That's an option. And really be sure that the person that you're denying and like the reason behind it and making them aware, like that's a bait and switch doctor. Because I've had that conversations with people.
Yeah.
In fact, I have a client right now who didn't go with me over 2 years ago, and now she's back and she's going for a VBAC after 2 cesareans. Yeah. She's like, I should have listened, right?
Yeah.
And I gently let her know during that conversation, like, you're with not a great provider. Like, you're with someone who bait and switches. You're with someone, like, I would not recommend.
Yeah.
But the comfort in that moment was higher to her than switching, which I understand.
Yeah. Because there is work that has to be done to switch providers,
right?
And things like that.
Yeah, there can be more often than not. It's just calling a new provider and being like, "Hey, can I come see you now?" They do all the work.
The only reason why I was comfortable switching is because the people that I switched to were like, "Oh, we'll call and break up with your old provider. Cool."
The majority of offices do that. The majority of offices will do that for you. So that's why I'm like, really the comfort comes down to like the person being like, I don't want to find a new office and like I have to establish this new relationship and all of that. So that's a gentler way to have that conversation. Another gentle way of doing it is like, oh my God, you're a VBAC. Here's a list of some of my favorite providers to work with as a VBAC. It puts you in a place of authority.
Yeah.
Of I've already done this.
Here are these people are.
Here's my favorite people. Because I've worked with them, like, listen to me. Yeah. So that is a gentler way to have that conversation. And I hope that you have that information. If you don't, like, again, reach out to your local ICANN. ICANN ladies will, like, set it straight. They have...
help you out, yeah.
They are brutal in their groups because they run those providers through the ringer because...
As they should.
Yeah.
As they should.
Yeah. So that's the question.
I need to start that for like that version of like finding non-fat phobic providers.
Yeah. I think it's out there though. I think people are begging for that kind of space. Yeah. And I joked once that you go to an ICANN meeting and there's not a single soft soul in there because
everybody's like a badass.
Right. Yeah. Because they had something happen to them and they were like, no thank you.
That was not fair. And that was not cool.
No. And now I'm going to be in this space making sure everyone knows I talk shit about you. Like,
yeah, we're not doing this privately.
No. I'm gonna speak my mind. So those are the questions that were asked. I think they were fabulous questions. I'm really impressed by them. So there you go. Yay. All right. As always, else? I love talking about VBACs and genital cesareans. Feel free to reach out to me and give me questions or like enjoy my content because I'm constantly talking about it, or one of my classes that's coming up because I think it's important for all of us knowing it. Like,
I and that's where it's like, it's not like, oh, I'm just picking up Emmy because she's my podcast partner. It was a valuable class, and I feel like I have interviewed with VBACers before, and I'm like, sure, right? But not in that way, but even not in like a bad way, but even just like,
it can be intimidating.
I don't know all these things, or I will hear them say myths that, but I didn't know they were myths at the time, kind of thing. Like, oh, I was told I can't have an epidural, so I that's why I need a doula. Or the opposite, I have to have an epidural. Like, that's when you're like, okay,
which one is it?
Which one is it? Because this person told me they were told not to have an epidural, and this person said that they had to have, like,
yeah,
right, like, whatever the reasoning is behind it. But it is, like, helpful to, like, someone to tell you, like, okay, these are the facts.
Right. Not only the facts, but, like, why did that person get told that by that certain provider, but someone else was told something different? Yeah. Because if you have that information, that makes you a more powerful doula for them. Yeah. Because you're not just like, that sounds dumb. Why are you being told that? You
like know why. You
have the context to
and
why.
Those were the consults that I was like glad that they didn't call me, because I did not feel prepared for it.
But you're prepared now. You're so ready. And you know, I think it's fabulous that you're a VBAC wizard now, and like I think that goes to show anyone that I touch in my space is going to end up learning about VBAC, whether they like it or not. Like the true, like,
even literally everybody listening to this right now is exactly all this information.
Like my cusping of like being like aspy to a point of like, let me tell you fun facts. Like, well, thank you guys for joining Ring of Fire. I'm Emmy the Birth Wizard,
and I'm Alex Barr.
Till next time.
What was that? We don't know. Okay. No. Was that us fading away?
Yeah.
Okay. Got it.
We both should do it in like literally leave frame.
Okay.
Ready?
Let's do it.